My name is Reza Niles-Robin, and I'm the Director Acting for Vector Control Services within the Ministry of Health, Guyana. Malaria continues to pose a significant health risk to our families, especially in the mining areas where many of our community members work tirelessly to support their loved ones. LLINS, or long-lasting insecticide-treated nets, are powerful tools in our fight against malaria. These nets have proven to reduce the transmission of malaria by providing a barrier against mosquitoes that carry the disease. But who are we targeting with this campaign? Our focus is on the most affected member of our community, those living and working in the mining areas where the risk of malaria is highest. It is our duty to ensure that every family, every child, and every individual has access to the protection they need. Long-lasting insecticide-treated nets mass distribution campaign 2024. The use of long-lasting insecticide-treated nets is the major vector control strategy adopted in Guyana. Within the National Malaria Strategic Plan, under Strategic Priority Number 4, it has outlined one of its goals as the need to optimize the distribution and the use of these treated nets in malaria-affected communities within Regions 1, 7, 8, 9, and 10. This will be achieved through the mass distribution of free insecticide-treated nets to be held every 3 years in Guyana, an activity which will be supported by continuous net distributions through multiple channels. This activity will also be supported through the implementation of social behavior change and information, education, and communication (IEC) materials in response to the limited access to and the use of this important prevention tool. The distribution process. The LLINS distribution will be implemented in one of 3 methods. Firstly, bed nets and hammock nets will be distributed by the health staff in the respective localities to the residents' population of the nearby village. Secondly, the nets will be distributed to the tashos of distant villages in order to facilitate the distribution to the indigenous and non-indigenous population. And thirdly, LLINS will be distributed to camp owners, managers, and mining organizations for distribution to their personnel. In order to uplift your free treated nets, you will need to present a form of identification for the personal details to be collected on the net distribution form. For example, the ID card number, or birth certificate number, or passport number, or driver's license number, etc. Where the recipient is unable to read or write, an ink-stamped right thumbprint will be required. If there is no right thumbprint, then the left thumbprint is required as proof of receiving a bed net or a hammock net. Let us unite in this endeavor. Let us take a stance against malaria and protect our loved ones. Together we can create a healthier, safer future for all as we unite against malaria.